Ladies and gentlemen, welcome to MedSynapse Podcast series. I'm your host, Dr. Nigar, and today we will be discussing on a very crucial topic, testicular cancer, where we will be focusing on the risk factors, early detection, diagnosis, treatment, and post-treatment care. Joining us on this topic is a distinguished guest, Dr. Arnil George, a consultant clinical oncologist at Prince Court Medical Center, Kuala Lumpur, Malaysia. With a medical degree from Ireland and a master's in clinical oncology from University of Malaya, Dr. Arnil's passion and proficiency bring a wealth of expertise to our discussion today. Notably, Dr. Arnil has taken part in numerous clinical trials and has been actively involved in clinical teaching for the Oncology Postgraduate Training Program at the University of Malaya. Welcome, Dr. Arnil.
Hi, Dr. Ninja. Thank you for having me for this podcast.
Thank you so much for joining us today. Now, before we begin, I would like to ask one personal question. What initially sparked your interest in the field of oncology?
That's a very good question. I would say that I felt there was a need. I mean, there are many other oncologists in the world, but I felt there was a good need to, improve the quality of oncology care. And so I embarked on this long journey to treat cancer patients. And at the same time, I also felt that I know a lot of people, a lot of doctors themselves feel that, cancer treatment someone diagnosed with cancer is actually quite a scary profession to enter. But I felt that there was a need, and I felt that even in an emotional aspect of treating patients with cancer, especially in the terminal setting, I felt that I could deliver give my expertise in that way.
Thank you so much for sharing your insight into your passion for oncology. Now, let's begin our podcast. Dr. Arnil, could you outline what doctors should know about the rare but this vital topic of testicular cancer, like its risks, signs, and when to be concerned?
Okay, testicular cancer generally affects the younger males, younger men between the age of 15 years old to about 40 years old. But generally, you see them on the younger age group. So we do find that, basically what one needs to look for in terms of testicular cancer is generally the young men generally present to the doctors with testicular swelling, and subsequently they will come to see a GP, and you need to quickly ascertain whether this is something sinister or not. I mean, there are many other symptoms and signs that one needs to look out for. Of course, you look out for pain, any back pain, which could signify, really more of a sinister aspect of it. But it's either swelling, scrotal swelling, back pain, as I mentioned earlier. And one of the more sinister aspects of it is loss of weight, loss of appetite, which could mean a more advanced disease in that sense.
Now, what's the best way for doctors to guide male patients in performing regular self-checks for possible testicular issues?
Okay, I think all young men need to be well aware, and especially us doctors, especially in the general practice, need to enlighten patients, young men, to have regular self-checks, and these are self-checks meaning self-testicular examinations. And you could actually Google a number of these ways where you can do these self-checks at home, and there are many diagrams that you can see where basically the young men should examine themselves under a warm shower, and basically looking for and then feeling their testicles and scrotums for any abnormal swellings, as such, any tenderness. And this should be done actually monthly. It's recommended to do monthly or every 2 monthly. In the event that you do find anything that is worrying, well, they should actually visit their doctor, their GPs at least, and then point out, this any swelling so that they can move forward to necessary testing.
Distinguishing testicular cancer from other conditions can be a diagnostic challenge sometimes. So, when diagnosing, how can doctors distinguish between testicular cancer and other similar conditions that might show up?
So, when you talk about testicular cancers, of course, not every testicular swelling is testicular cancer. Of course, you need to look at the age group that is involved. As I mentioned earlier, it's the younger age group. So the main thing that you want to look for is you will need to distinguish by a simpler blood test. A lot of times you can do a urine pregnancy test. Now that sounds weird, but what you're looking for is any raised beta HCG in the body, which it generally can be it's actually abnormal in men. So that's one way to check quickly whether there's any possibility of testicular cancer. And then subsequently, you need to actually possibly refer to a urologist for better examination. The urologist would probably organize an ultrasound of both testes to see whether there's any abnormal features that could represent a testicular cancer. But on the other hand, the more acute problems of testicular swelling could be testicular torsions, which generally present with acute pain. Those may not be, actually testicular cancer. And sometimes alternative diagnoses need to be entertained, like things like hydrocele and all that. So a lot of times it's a quick blood test or a quick urine pregnancy test. You could do a blood test of the tumor markers, alpha fetoprotein, beta HCG, and this could, point out whether this could be pointing out to any form of testicular malignancy. So, but a lot of times it does take experience to examine the young man, and this would to define whether this is more of a benign disease or a malignant disease.
Let's proceed to our next question. Collaboration is key in complex diseases. Could you explain how oncologists collaborate with other specialists to create full treatment plans for testicular cancer patients?
Okay, that's a good question. Now, one has to realize that testicular cancers don't really present immediately to the oncologist. A lot of times they are diagnosed by basically their general practitioners, who would subsequently refer them to the urologist. And there are many blood tests, as I mentioned. There are many investigations that would probably be addressed or be organized by the urologist. And also the radiologist also plays a big role. So the first things first, the common blood investigations that would need to be done. You need to check the full blood count, the renal function, the liver function. Tumor markers play an important role, alpha fetoprotein, beta HCG, and LDH. And of course, if there is a need for the ultrasound testis, and if there's further suspicion of testicular malignancy, then one would need to organize a CT scan, thorax, abdomen, pelvis at least, to define whether there's any other spread of the disease if they think that this is a testicular tumor. Now, when it comes to when someone defines that this is likely a testicular cancer, now we look at the tumor markers, and the tumor markers can help us out a lot to define what type of cancer it is. And I think we will move on. That would be explained, I believe, in our next question.
Moving on, what are the main treatments for testicular cancer, and how do doctors choose the right one based on stages and types of the cancer?
Okay. So, as I mentioned before, the tumor markers play a big role. Histologically wise, when you talk about testicular cancer, it can be defined to different pathologies. And the more common pathologies that we look at is whether it's a seminoma or a non-seminomatous germ cell tumor. So we need to look at into these two possibilities. Now, overall, we know that in a non-seminomatous germ cell tumor setting, the tumor markers are actually raised. So the alpha fetoprotein and the beta HCG is raised. In a seminoma side, the seminoma component, these tumor markers are not raised. So there is a dilemma in terms of diagnosis. So this is the important factor, that important test that you need to do. And then subsequently, if you're unsure about whether this is a seminoma and whether it could be a different pathology, that's where surgery comes into the picture. But before that, you would probably need to do the staging, as I mentioned earlier, the CT, thorax, abdomen, pelvis, and that staging will need to be addressed whether this is a local disease whether it's in the testes or it has metastasized to the abdominal lymph nodes, or furthermore, will it metastasize to the lungs and any other sites. So if it's a local disease, i.e. a stage 1 cancer localized to the testes, what normally would happen is that a patient would undergo surgery. And surgery would, i.e. means it's a left orchidectomy, and that's where the testis is removed, and it would be sent forth to the pathologist. And that's where the pathologist would let us know whether this is a seminoma or a non-seminoma variant of the tumor. So when it's a non-seminoma or a seminoma, that's when you decide what is the next treatment involved. Of course, the treatment also involves changes when someone has distant metastasis or spread of the tumor in the lung or in the abdominal lymph nodes. So you need to have all these things in hand. You need to know your tumor markers, number one, whether it's present or not, and if it's not present, you need to do, especially in the seminoma setting, you need to have some form of histological diagnosis. And of course, the scans would also tell us whether this is an early stage or a late stage. So if we want to move on towards, let's put it briefly, in a stage 1 setting, whether it's a non-seminoma or a seminoma, we want to look at risk factors in the histological sample. In a non-seminoma, you're looking for whether there's any lymphovascular invasion. This is a high-risk feature for early recurrence. While in a seminoma setting, you're looking at size of the testis, size of the testicular tumor, or whether there's any presence of rete testis. So when we look at histologically in the stage 1 setting, you want to look for high-risk features. And if there's absence of high-risk features, there's actually something that we need to discuss with our patients about active surveillance post-orchidectomy, whereby they actually do not need treatment, but they will need to be followed up ever so closely over the years to look for recurrence. And if there's any recurrence, then they will have treatment. Some patients in the stage 1 setting, whether it's non-seminoma or seminomatous setting, they may still, even with the high-risk features, even without the high-risk features, sometimes you would still want to discuss about treatment, which involves either chemotherapy and sometimes radiotherapy may be involved. And these are the patients where you feel that, they may not want to be followed up closely, or you feel that they may default regular follow-ups. So you might want to discuss with them, hey, maybe you should undergo some form of treatment after orchidectomy in order to prevent the recurrences. So it's a lot of discussion with the patient when it comes to treatment of testicular cancer, especially in the stage 1 setting, because you might be over-treating them with treatment upfront, and there's a lot of side effects that you need to talk about when it comes to treatment. So, there's when you talk about treatment in terms of cancer treatment, you need to prepare them for a lot of, prepare them prior to chemotherapy. So as I mentioned before, when it comes to chemotherapy, we need to probably consider sperm banking because most of these gentlemen they probably want to start a family later in their lives. So we have to consider sperm banking, and there are also things like we need to do a lung function test and echocardiogram prior to starting chemotherapy. If you want to talk about in a later stage of cancers, where in the stage 2 or stage 3 or in the advanced stage, now in most situations we would have to consider starting chemotherapy for them. And this involves about 3 to 4 cycles of chemotherapy, and it's quite intensive chemotherapy, I would have to say, and a lot of patients have to be guided through this kind of treatments because this it's about it's chemotherapy, 5-day admission for chemotherapy, and it's every 3 weeks of treatment, and it may go up to about four cycles in total. And a lot of times when I deal with patients with chemotherapy, with testicular cancer and chemotherapy, I have to be honest, I have to forewarn them that it is going to be intensive for them, and whatever said and done, they have to follow the instructions as best as possible, and to come into in the events of any side effects. But overall, it's actually a very complex algorithm of treatment. So we really need to spend time talking to them about, in an early stage as well in the late stage of treatment of testicular cancer.
Thank you so much, Dr. Arnil, for giving us a stepwise approach to treatment and management strategies in testicular cancer. Now, moving on to the next question. Measuring long-term well-being is a priority. After treatment, what's your advice to doctors on monitoring long-term health concerns for testicular cancer survivors?
A lot of times in my setting, I would ensure that my testicular cancer patients who are in remission after treatment, whether they had treatment or not, they need to be followed up ever so regularly. And especially when we consider that early relapse is actually at 2 years is considered an early relapse. So a lot of times we need to monitor them for side effects from oncological treatment, which is chemotherapy. A lot of times we look for any cardiovascular diseases that can arise from their previous chemotherapy that was done, or any secondary malignancies that can potentially happen. Because one thing you need to understand is that a lot of these gentlemen, they are young and they survive for a long time. And by giving early treatment in terms of chemotherapy at an early age, there is a risk of secondary malignancies about 20, 30 years down the road. So it's something that we need to look for in our setting. Of course, there are other things that you need to look out for. There's also long-term risk of hypogonadism after treatment of testicular cancer, especially in advanced disease. So you need to actually check their testosterone levels, and you need to offer testosterone supplements, which we will probably work well with if you discuss with the endocrinologist for that. Other side effects that sometimes quite more difficult to address is probably fatigue, and these are the common symptoms that most of germ cell tumor survivors. So these are some of the problems that one needs to address in terms of long-term monitoring of patients. Essentially, monitoring is important to look for relapse, as I said before, and these are looking at tumor markers, again, regular CT scans, regular physical examination if you're the doctor that is monitoring germ cell tumor cancer survivors.
Lastly, how are genetic and molecular tests helping personalize treatments for testicular cancer patients, and why is this approach beneficial?
Okay, now this is not going to be an easy question to answer. I've done some reading on any new evidence of molecular tests that can help. You might come across something called the miRNA, which it is used in a clinical one staging, and to see whether there's any benefit of further treatment for patients in a stage one setting, especially after orchidectomy. But unfortunately, this miRNA is actually not something that is used in real time at this point of time, and I think a lot of times we are still there's still a lot of testing or to see whether this is an efficacious way to decide whether, in an early stage testicular cancer, whether such situations are beneficial or not. So I wouldn't use any form of serum genetic testing or molecular testing at this point of time to decide or to predict whether such patients can develop metastasis in the future, whereby they need adjuvant or treatment after orchidectomy. So honestly, I don't think it's beneficial at this point of time. The mainstay of treatment is still chemotherapy and radiation when necessary.
Dr. Arnil, thank you so much for joining us on today's podcast. Your expertise and insights today is both valuable to us and to our audience. Truly appreciate your time and today's great conversation.
Thank you so much. Thank you so much for having me here. I think on the side note, I feel that I failed to address something with regards to advanced testicular germ cell tumor. Something that we need to know is that sometimes, in a lot of times, when someone who's symptomatic from advanced germ cell tumor, where they have shortness of breath and there's high index suspicion of germ cell tumor based on testicular swelling as such patients, you do not need to wait for histological diagnosis. Elevated tumor markers in a non-seminomatous germ cell tumor setting, the oncologist can actually start early treatment because you can save lives. And one thing that all doctors should be aware of is germ cell tumors actually prognosis, especially in the early setting, is excellent. And most patients actually in an early stage actually have very good prognosis. They survive. The 5-year overall survival is about almost 90%, 90 to 90% in both histological diagnosis. Even in an advanced setting, we can still consider curative intent, whereby some patients actually even in an advanced setting, they can have actually 67 to 70% overall survival rates over 5 years. So something to be very clear about. So testicular cancer is a very treatable disease, and we should diagnose them early and treat them early as soon as possible.
Thank you so much, Dr. Arnil, for sharing your expert advices today. And to our audience, we truly appreciate your time and attendance with us today. And this video was made possible by MedSynapse, a leading platform for medical collaboration and knowledge sharing among healthcare practitioners. If you haven't already, be sure to subscribe and register on our platform to stay updated with the latest developments in the field of medicine. Thank you all for your participation today. Until next time, goodbye.